Hi, Teresa Nutt here. We're going to talk about diabetes and kidney disease today. And I'm hopeful that most of you have heard something about it because diabetes is a topic that most everyone has been exposed to in one way or the other. It's very prevalent. Start with a definition, and really diabetes is about the body's inability to get the glucose it needs to make energy. And that can happen in a number of different ways, and we'll go through each of them as we're talking about the different types. But there are several main symptoms of diabetes depending on the type, and we'll go through them in detail, but here's a quick snapshot. So it's, thirst, hunger, being lethargic or fatigued, not quite thinking or talking right, blurred vision, a funny smell on the breath, weight loss, hyperventilation, nausea, vomiting, abdominal pain, frequent urination or sugar in the urine or glucose in the urine. So just know that's the snapshot of symptoms. And we want to just bring your attention to the fact that diabetes is a really expensive condition. As you can see, $245 billion spent on diabetes in 2012. And people with diabetes spend an average of $13,700 a year per person on their health care. So it's an expensive condition to manage on an annual basis. There are several complications of an uncontrolled diabetic, and good solid control is really what is needed for diabetes to help prevent complications, to help the person feel as well as they can throughout their day, etc. So as a coach, you'll want to know that. But the complications include things like heart attack, stroke, diabetic coma, and death, chronic kidney disease, eye disease, blindness even. I would say eye disease can turn into blindness, nerve damage, and slow healing of extremities that may lead to amputation. And with nerve damage, I would also add nerve pain, and they call that neuropathy if you want the term. So there are three types of diabetes: type 1, type 2, and gestational, which is during pregnancy. And with type 1, it's generally a childhood or young adult disease. It can be for people older than that, but it's generally from infancy to late 30s. And it's because their pancreas simply does not produce insulin or not enough insulin. And the body's immune system destroys the insulin-producing cells in the pancreas. So the insulin's just simply not available. It doesn't exist. These people must take insulin daily. You're going to see that's the difference between the types of diabetes. With type 1, these people are on insulin. Medication alone will not help them. And there are several factors. You can just look at them real quickly, but there is an autoimmune component to type 1 diabetes, and so it's good to know that as you think about other clinical conditions. So type 1 diabetes is really a small prevalence of the population. It's 5 to 10%, and again, it's mostly children and young adults. How you know symptomatically if you're trying to diagnose, and not that you would be trying to diagnose but their healthcare provider, how they differentiate is that type 1 diabetes usually develops over a short period of time. There's a concentrated period of time with symptoms like increased thirst and urination, constant hunger, weight loss, blurred vision, and extreme fatigue. So these are the things that help a person know this is probably type 1 diabetes. And then they would do testing and other things to confirm. But a person with type 1 diabetes can more easily than type 2 lapse into a life-threatening diabetic coma. So it's really, really important to get them help. Whereas type 2, the pancreas is producing insulin, but the body's not able to synthesize or use it. So that's the difference. In type 1, they don't have the insulin. They're not making it at all. In type 2 they have it, but they can't actually use it. The difference between type 1 and type 2 is that with type 2, lifestyle management can hugely impact the trajectory of diabetes. And in some cases, people have actually been able to reverse their diabetes using lifestyle management. So this is type 2 diabetes. I want to be very clear that this is very different than type 1. However, having said that, after several years, people with type 2 diabetes, generally their insulin production will decrease. So lifestyle management may work for a period of time and then no longer work. That's just part of sometimes the progression of that condition. And the result of type 2 diabetes is that this glucose builds up in the body. So here's all this fuel source, but I can't use it. And medication is often used to help with the management of type 2 diabetes, at least initially, to help get the blood sugars under control and to help the body start to absorb and use the insulin that's available. So type 2 diabetes is the most prevalent. It's 90% of the population. And there are certain populations that are at really high risk of diabetes, and that is the older, the obese, a family history, so there's a strong genetic component. Also pregnant, women who have been pregnant and had gestational diabetes during their pregnancy are at risk, and those who are physically inactive. And as far as population risk, it's the African American, the Mexican American, and the Pacific Islander youth that are at the highest risk of being diagnosed with type 2 diabetes. There are several things that contribute to diabetes, and those include high blood pressure, high fat and cholesterol diets, overweight, and I would say high fat and cholesterol levels, but those come from high fat and cholesterol diets, being overweight, having a sedentary lifestyle, and smoking. Symptoms of type 2 diabetes are really more like fatigue, frequent urination, increased thirst and hunger, weight loss, blurred vision, and slow healing of wounds. And again, the difference between type 1 and type 2 is with type 2, those symptoms develop gradually over time, and they're not really sudden, so it can be a little harder to realize that something is going on. And some people have no symptoms with type 2 diabetes, so that's also important to know. So gestational diabetes may occur during pregnancy, and it causes problems for the baby if it's untreated, which is why early prenatal screening is so important. It can cause the body to become larger than normal for the baby. It can cause a low blood sugar for the baby right after birth. It can cause breathing problems. It can cause risk of death. It can cause the baby to become overweight or obese, and it can cause that baby to develop type 2 diabetes later in life. So it's really important to note. So obviously with diabetes, you're going to need a really solid healthcare team. This is not something you want people to be not tending to. Their healthcare team is going to be mission critical. And so obviously besides themselves, they're going to need a primary care provider, an endocrinologist who specializes in diabetic care, some kind of dietitian or diabetic educator who can really help with the lifestyle changes such as diet and managing the side effects of medications and other things about managing diabetes, what screenings they need to have and how often and all of that. You want a diabetic educator helping with that. They'll need a podiatrist for foot care because maintaining foot care is huge, as well as ophthalmologist for eye care. And then really as a health coach, you can help in so many ways with developing their personal wellness, helping them determine goals and working through developing their support network. So here's the self-management. Following a healthy eating plan is obviously huge for diabetes. Being active, taking medications, checking blood sugars as ordered or blood glucose levels, checking feet daily. So this back we talked about foot care. You really need to be checking for cuts, blisters, sores, swelling, redness, or sore toenails, because with diabetics, any kind of issues with their feet can quickly become something more significant that doesn't heal properly. And this is where people who don't tend to that can end up losing a limb over time. So you want to catch it so early, so that is a daily thing, and there's a reason for that. brushing and flossing teeth. As a cardiac nurse, so I was a cardiac nurse for many years, one of the biggest indicators of cardiac health is periodontal health. So it may seem a little funny, but good brushing and flossing impacts your heart health, which impacts your diabetic health, so it's really important. Managing blood pressure and cholesterol levels, huge, and avoiding smoking and alcohol. So this just gives you a snapshot of what their annual screening and management is. Again, just because diabetes is so prevalent, and it'll just give you a feel of what's happening in the background. So once a year, diabetics have kidney function tests, and those include a urine test and a blood test. They will have an eye exam, they will have a flu shot and a pneumo vaccine if they're over a certain age. Twice a year they'll have testing called an A1C, which kind of gives you an average blood glucose level for the several months. And I know some of this you covered in lifestyle medicine, so forgive me for repeating. But I feel like with diabetes I want to make sure for the people who are less familiar they definitely get some of these key things down. As well as blood lipid lab tests around cholesterol and triglycerides. They need a biannual dental exam and a foot exam twice a year. So all of those things happen twice a year. So some of the common concerns, as I mentioned, will I lose a limb or my eyesight? It can be a struggle to make the dietary changes or to get active or to manage symptoms at work. And also people can struggle with the side effects from their medication. Here's Dr. Andrew Weil's Care for Diabetes. So if you see it, it's very in line with conventional, and then has some other things. So he looks at losing weight, managing diet, and then there are some supplements to take a look at the bottom. And notice he says right in there, work with a physician and a nutritionist. So integrative interventions in communion with conventional interventions is really the best of both worlds. So I want to talk about chronic kidney disease, and we add it to diabetes because it's really a complication of diabetes generally. Very rarely is it a standalone thing. But the function of healthy kidneys is to filter waste and excess water out of the blood to make urine. Bottom line, it helps balance the body's chemicals, control blood pressure, and make hormones. So these are the things your kidneys are doing if they're healthy. When they are diseased, they are not filtering blood properly. So waste builds up in the body, and it can create permanent damage to the kidney, and they will become less functional over time. So symptoms of kidney disease, the reason why we are so diligent about screening diabetics is it's generally asymptomatic until the disease has progressed. And the sooner you can catch it, it's really, really important. But some symptoms of advanced kidney disease are feeling weak and tired, loss of appetite, poor sleep, not thinking clearly, and swelling of feet and ankles. And all of these are due to that fluid backup and not getting the waste out of the body. So the side effects are high blood pressure or hypertension, heart and blood vessel disease, anemia, weak bones, loss of appetite, and as a result of loss of appetite, malnutrition. So here are some references. Again, you'll have access to all of this, but get your websites down so that you can check in. And I hope this overview was useful.